Sometimes I find teenagers or young adults have a fever but feel well and don't believe that it can be a sign of a serious illness. And so they'll think, well, I could just take care of this at home. I'll take a little Tylenol and I'll feel better. And that's true for somebody who doesn't have sickle cell anemia, and it's true sometimes for people with sickle cell anemia. But because I've seen people with sickle cell anemia feel fine 1 minute and be very, very ill with a potentially deadly infection very soon thereafter, I strongly encourage all of our patients, as soon as they have a fever, to call us, even if they feel well.
I always try to manage at home at first, no matter what. I try to take my meds, pain meds that I was prescribed. I try to soak in like a hot tub or rub down with Bengay or something, see how that's going. And after like 2-3 hours, if it's no sign of getting any better, then I know it's better to just go to the ER.
I know everybody feels different types of pain, but the thing is just when I'm, say, at a 3, I'm just uncomfortable. When I'm at a 5, then it's climbing up. Maybe then that's what I need to take pain medication. When I'm at an 8, I'm in crisis. Like I'm on my way to the hospital. But the thing is also, with getting to the hospital, with being at an 8, I immediately need IV fluids and pain medication. And if I don't get that right away, my pain skyrockets to a 10.
Like if you were to have like a fever or shortness of breath, I never want to risk it at home. I always want to go to the hospital and try to make sure I get everything taken care of. I do remember taking my sister to school one day, and I was having difficulty breathing. And I dropped her off and I went straight to Robert Johnson.
With sickle cell, you have a chance for a stroke. So an 18-year-old could get a stroke, which is unheard of just for a normal, healthy kid. So all these checkups are not just checkups for checkup's sake. They actually have a purpose, and they help save lives. They actually do help save lives. Because if they find an irregularity, they can immediately start treatment. Whereas if you start battling it after it happens, it just decreases the chance for like a healthy life.
There's lots of reasons to go to the emergency room. The most common reason is if they have a fever, because fever in sickle cell disease is an emergency. That's at any age. That's because starting at a young age, your spleen starts to scar due to sickling of cells in the spleen. So your immune system is not quite the same as somebody who doesn't have sickle cell disease. In regards to vision loss of sickle cell disease, is the people typically affected by this are the people doing the best, because the patients who have a bit of a higher hemoglobin, so usually the patients who have more moderate types of sickle cell disease are the ones that are a bit higher risk, because the blood's a little more viscous, a little stickier. And if you do pick up, on a potential concern early on, it's very fixable. If you wait till you can't see, it's not fixable. It's very important to work with the primary doctors closely as a team. We like to be called first because we're the ones who are going to be taking care of you, and we want to make sure that you're not handled like somebody who doesn't have sickle cell disease by a physician who may mean well but is giving you the wrong advice. One of the emergencies that is very important that requires a trip to the emergency room typically, or other emergency intervention, is something called priapism. That's a prolonged painful erection. Obviously, it typically happens. Obviously, only happens in men, and that's because of sickling, and that's very important. We do teach the kids when they hit middle school to please tell your parents if this is happening, because the longer it persists, the harder it is to treat. And that if not treated properly, that can lead to impotence when the children are older.